to actually welcome Minister Norman Lamb. We're doing this together, Charlotte and I, and you will all have been aware of the huge and very exciting announcement in the press last week about a fabulous paper which has come out, which informs the direction for mental health for people unto, I think, the next few years. And also within this, we were delighted to see that children and young people were not an add-on. They were woven throughout the entire paper as a complete life course, and particularly highlighted for the CYP IAPT programme.
It's absolutely my delight to now welcome the Minister for Care and Support, Norman Lamb. I have been lucky enough to be involved in the Children and Young People's Mental Health Task Force, and we recently had our first meeting. It was absolutely fantastic to work alongside a group of individuals who were so passionate and dedicated to improving children and young people's mental health services. I am sure we will come up with an absolutely fantastic report, and we'll be looking to the Minister to make it stick from the top. The Minister can only be with us till 11 and has kindly agreed to take questions. So, without further ado, it's my absolute pleasure to hand over to the Minister for Care and Support, Norman Lamb.
Thank you very much, Charlotte and Jackie. It's my misfortune to follow on from those performances. They were, I thought, incredibly powerful, and there's some extraordinary talent on show here this morning, and it got across some really important messages very effectively. And thanks also, incidentally, Charlotte and Jackie, for mentioning the announcement last week, which I'll come back to in a little while. I do think it's a massive opportunity for us to finally get mental health the recognition that it deserves. There is a long way to go, but this is a sort of personal mission of mine, and one that I feel very strongly about. Now, at the start of life, the future is always very uncertain. None of us know what challenges lie ahead. Those of us who are parents often have a lot of optimism at the start, but we don't know what challenges we will face as a family. And we have to ask the question, does the state in this country support children as they grow up effectively? Mostly, the answer is yes. They have access to free education, they have free healthcare, staffed by highly trained and caring professionals like you in this room. But I say mostly because there are areas where we don't support youngsters as well as we could and as well as we must. And mental health is one of those areas. The system that we have now for children and young people's mental health is far too complex. The commissioning of services is too fragmented. It makes no sense to me that we've got 4 different organisations, local authorities, schools, clinical commission groups and NHS England, all involved in the commissioning of services for young people. And that's deeply frustrating for the thousands of dedicated professionals working in these services. And I know that you are doing your very, very best to achieve the best outcomes for children. But too many services are still not built around the needs of young people themselves. And it's sometimes difficult to think back to our time as children. For the lucky ones in this audience, that's not too long ago. For others, it is. The world which children are born in today, though, is wildly different to that inhabited by the average 40 or 50-year-old when we were young. 24/7 television on hundreds of channels, instant access to really explicit material online, social media, which ironically can make youngsters more withdrawn from loved ones. There is pressure for them to be a certain way, a sort of pressure to conform, not only from classmates but from every television, every computer screen, and the constantly refreshing content accessible on the phone in their pockets. This isn't to say that all young people are as malleable as putty. They aren't. So many are really smart, able to make up their own minds. But the pressure is constant, unlike anything we experienced. And for some, it is too much. Of course, we live in a country where acts of violence by and against young people, from stabbings to muggings, are all too common. And we've recently seen in Rotherham that children and young people can be the victims of monstrous abuse. All these and many other facets of life can become incredibly distressing for children and young people. And for some, this tips into illness, as the presentations a few minutes ago so ably demonstrated. At times, that line from Philip Larkin, "Man hands on misery to man, it deepens like a coastal shelf," seems all too true. Everyone in this room is pushing back that tide, keeping at bay, so that young people aren't consumed by mental ill health. All of you are trying to help young people as best you can, but I know some of you are dealing with years of underinvestment in this service, and I am acutely aware that in too many areas there have been cuts to funding over the last 3 years. The Young Minds survey demonstrated that a few months ago. I know all of you are doing your best to provide the right care to every child and young person you see. I also know sometimes, for those with severe mental illness, that care can be miles away from where they live. Now, earlier this year, NHS England reviewed inpatient Tier 4 CAMs. That's just the jargon we use, incidentally, is just pretty alien, it seems to me, to most of the people beyond professional circles. But they found that the number of NHS-funded CAMs Tier 4 beds increased from 844 in 1999 to 1,128 in 2006, rising further to 1,264 in January 2014. But despite this overall increase, NHS England found relative shortages in the southwest and areas such as Yorkshire and Humber, resulting in patients being admitted to services unacceptably far from home. Now, you will have heard about the extra money coming for inpatient beds to stop this from happening. And although I'm delighted we've secured those extra funds, I know that inpatient beds are not and must not be the only solution. To provide the very best care, this needs to be complemented with excellent community services that work to prevent problems, to intervene early, and to support those who need it. Ultimately, surely we must try to escape from the inexorable rise in numbers of beds. A different approach surely is needed. Now, I heard firsthand from Lisa Nolan, the programme delivery manager at the Liverpool CCG, of the work that they are doing in Liverpool CAMS with the partnership there. Over a number of years, they have been steadily working to change CAMS care pathways and improve choice, access and transition. This partnership brings together commissioners and providers from the NHS, from local authorities and voluntary care sectors, seeking to create a single point of access for services where they can easily monitor activity, outcomes and quality. Now, this has led to significant reductions in specialist CAMS referrals. They have done it. Over 90% of those accessing services are showing improvements in their mental health. 90% of users have a high satisfaction with services, and there is an increase year on year in staff accessing training. It demonstrates what's possible when commissioners bring providers from the statutory and the voluntary sector together. Now, my ambition when I came into office was to transform mental health care, working together with others, and to instigate a broad change in the way that people of every age with mental health problems are supported by society as a whole. As I said at the start, this is a personal mission of mine. I care deeply about it. There is an absolute need for change, and the need for investment along with change is, in my view, overwhelming. I think we are making progress despite extraordinarily challenging times. This year, we have first of all launched a document in January called Closing the Gap. This was our action plan, which sets out our priorities for what I regard as essential change in mental health. And I'd urge any of you who haven't looked at it to look through it and to judge for yourselves. But there were 25 areas there, all of which I believe are essential for change to happen. We then published the Crisis Care Concordat, now signed by more than 20 national organisations to improve mental health crisis care. As part of that, we said that the use of police cells for people in the middle of a mental health crisis should be halved during this financial year. And I am really thrilled to see that there is currently a dramatic reduction in many parts of the country in the use of police cells. In London, across London, last year they got the numbers down to just 88. Compare that incidentally with Sussex, where over 400 people went into police cells in the middle of a mental health crisis. But across the whole of London, down to just 88 last year. But this year so far, it's down to, I think, 17 people who end up in a police cell. Just imagine the impact on the lives of those people not being placed in a police cell. It seems to me to be a scandal of our times that this is still happening to thousands of people every year. It's intolerable, surely, that someone in the middle of serious and urgent ill health ends up being put into a police cell. It's intolerable, and we need to, I think, establish the principle that this should not be happening except in extreme circumstances. We've introduced the start of a liaison and diversion service based on national criteria, based on evidence. We've committed to start with £25 million to cover just under 25% of the country. We aim to double that next year with a complete rollout, subject to a business case demonstrating that it's working, by 2017-18. This is to end another scandal, that is the number of people in our country who end up in prison because of mental health problems or because of learning disability or autism. It doesn't have to be like that. It's a failure of public services that so many people still end up in prison when they shouldn't be there. So the idea of a liaison and diversion service based on the best possible evidence available in police stations and courts across the country is very powerful. And as Andy Bell, one of the leading thinkers in mental health, said to me recently, no other country in the world is doing this on the industrial scale that we are pursuing in this country, and it's something that we should be very proud of. We've also issued new guidance on the use of restraint and on cultures within inpatient wards, positive and safe. And it establishes the principle for the first time that deliberate use of face-down restraint is not acceptable. It's not appropriate in a modern mental health service. The guidance met with widespread support when we published it. I visited Merseycare recently and Broadmoor and seen amazing work underway. At Merseycare, they have seen a dramatic reduction in the number of staff who are injured at work and have to have time off work because of those injuries, down from, I think, 888 days off work in the 13 months before they introduced the change to something around 25 days off work since they introduced the change. It's making a real difference, creating a therapeutic environment in the wards where they've introduced it. And we've ended the exemption from mental health, for mental health patients, of the right of choice of where you get treated. Extraordinary, really, that you introduce a right of choice to people within the NHS about where they get treated, but you leave out mental health. This is the attitude that has pervaded the NHS for very long. It has come to an end, and rightly so. And then last week, as we heard at the start, we have announced that we will introduce, for the first time ever, access and waiting time standards in mental health from next April. The thing that I'm most excited about is a tough, exacting access standard in early intervention in psychosis. The evidence is overwhelming about the impact of that service. And yet what happens to you is totally haphazard around the country. How can it be right that someone with suspected cancer gets a right to an appointment with a specialist within 2 weeks of referral from your GP, gets a right to start treatment within a month of diagnosis, and yet someone who experiences a first episode of psychosis has absolutely no right at all? That has to change. There is a discrimination at the heart of the NHS which has to be confronted and changed. So this is progress, but we can do far more. We need to focus more on the mental health and well-being of our children and young people. You have heard, I hope, that the Deputy Prime Minister announced in this financial year and next a total of £120 million of investment in mental health. £7 million of that is to end the practice of young people being admitted to mental health beds far away from where they live, or from being inappropriately admitted to adult wards. This is a start, but again, we need to do more. We can build on your brilliant work in the Children and Young People's IAPT programme. Fantastic leadership from Peter Fonagy and his team in evidence-based practice, spreading it around the country. We've already achieved a lot. Our initial target was to work with 60% of services for the 0 to 19s population. We've already reached 68% of that population. I know from regular updates from Peter the work you've done to improve working and support with children, young people and parents, the work to use the feedback you get in sessions to direct therapy and to improve access to services. I want all the services that work with children and adolescents to be able to benefit in the same way. My goal is for CYP IAPT programme to cover the whole of England by 2018. And I know that from the work you've done up until now, we're within reach of that goal. But we must never be complacent about the need to constantly apply the principles of this programme to services across the country. This is not a one-off. It has to be repeated and continued, and I personally am completely committed to that. But it frustrates me that we just don't know some basic information about how many young children and young people need our support. Having 10-year-old data just doesn't cut it. Just think of everything that has happened in the period since then. I can understand why commissioners find it hard to predict how many children and young people they will need to support. Any number is an estimate. Many parents don't talk to their GPs about their children's mental health issues, and young people don't always feel comfortable about coming forward or know where to go to help. I want you to have the best information possible to understand how big the issue of mental health is for young people in your area. And that's why the Department of Health is now commissioning a new prevalence survey of children and young people's mental health. It was something that I insisted must happen. Now, we will have something we have needed for years, an accurate picture of prevalence of mental ill health. This, combined with the growing body of outcomes data being produced by you, will help inform how we plan and deliver services better than ever. Now, another thorny problem we've been grappling with for years is transition from children and adolescent services, whether to adult mental health services or to some other form of service. You and I know how vulnerable young people are as they become young adults. But on so many occasions, young people you have worked with fall off a cliff edge and end up with nothing, or in worst cases, coming back in crisis. So I'm delighted that NHS England is designing a new service specification for transition. Its aim will be to promote working across agencies, including primary care, local authorities and education, building transition around the needs of the individual. Now, I share their ambition to put transition into contracts, making sure funding is dependent on good, strong, positive experience reported by young people. Fundamentally, I strongly believe that 18 is a disastrous age to impose transition. There are important building blocks. These are important building blocks to improve the current system, but I want to go much further. That's why I commissioned the new Children and Young People's Mental Health and Wellbeing Task Force, which Charlotte mentioned, and I'm delighted, Charlotte, that you're involved with that. And they met for the first time in September. The task force brings together key leaders on children and young people's mental health from the health, social care, education and youth justice sectors, alongside experts, including Charlotte, to look at how we can improve services for young people. This must not be cautious. It has to be ambitious. In my view, it's a massive opportunity to decide between us the shape of services for the future. It must not be a Whitehall stitch-up. That's why we've involved so many people from outside. It will report next spring. And in my view, we have the great opportunity of informing whoever is elected as a government in May with how things need to change. Now, I've asked the task force to make recommendations and to drive further progress in providing joined-up, accessible services truly built around the needs of children, young people and their families. I'm absolutely clear that in order to achieve this, the views of young people and their families and carers must be sought. The task force has a cross-government remit and will report directly to myself and to my ministerial colleagues in education and the Department for Work and Pensions. I've had many conversations with parents and carers who say they have no idea where to go when they or a loved one are in need of help. So I'm pleased that the task force will focus on innovative ways of improving how children's mental health services are organised. New methods will be found to make it easier for young people to get access to help and support in health settings, in schools, voluntary organisations and online. I've asked them to look into a whole system approach which supports the young person through the care pathway, identifying problems early and helping them to develop resilience and emotional well-being from an early stage. But I want them to be inspired not only by the best work in this country, but from abroad too. I'm excited by the concept of youth information, advice and counselling services, like one in my own county of Norfolk. It's called MAP, the Mancroft Advice Project, which provides easy, non-stigmatised access, not just focusing on mental health, but on the range of anxieties that many young people face today. I'm also really interested in how this model has been adopted in Australia, where these services have a national branding, Headspace, which means that young people know where to go. They know it is their service. They know how they can access support wherever they are in the country. And just as we heard in the presentation earlier, the idea that the young person themselves can book an appointment without having to go through the gatekeeper of a GP seems to me to be fundamental to that. Now, I'm very keen that we make the best possible use of digital and online services to improve access and support for children and young people, building on the success of organisations like Cooth, who provide flexible access to counselling services, including online counselling, and Mindful, who offer online support, advice and discussion to 11 to 17-year-olds. So I've asked the task force to seek the views of children and young people themselves in considering how we do this. Some local areas, areas such as Newcastle, my own city of Norwich, Liverpool, are already making progress in developing innovative solutions to many of these really complex commissioning issues. I want to build on this, and I'm delighted to announce today that we'll be inviting expressions of interest, asking local areas to submit proposals outlining how they might go further with collaborative joint commissioning arrangements. I want to see projects spanning across health, social care, education and the voluntary sector for children's mental health services. And I want ideas to detail how the learning from this can be applied across the country. As a Liberal myself, I don't tend to favour ideas founded in Whitehall being imposed on the whole country from the centre. We've tested that approach to destruction. I want to find ways of unleashing the power of amazing leaders around the country to do what they know needs to be done, to remove the barriers that stop them in their tracks from doing the right thing. And in that way, it seems to me that we will have the innovation that's needed to improve services for young people. But in the meantime, it's important that we have conferences like today to bring everyone together from as far apart as Cornwall and Newcastle to learn from each other so that we can improve services. The challenge ahead is great. There's a long way to go to improve mental health care for young people, so excellence becomes the absolute norm wherever you live in this country. But I know, looking around this room and knowing very many of you and the amazing work that you do, too often held back by the system, I know that we have the power and the energy to change things for the better for our young people. I'm just desperate that we grasp this opportunity to do so. Thank you very much indeed.
Very much, Minister. As ever, that was a presentation straight from the heart, and really all of us feel very privileged to have you as one of our greatest advocates for children and young people's mental health. And we're pleased to know that at the first meeting of the task force, Charlotte and I spent a lot of time talking to each other, or rather she talked and I listened. I think that's probably the best way. And also, GIFT and the young people have contributed greatly to the transition service specification, so that when hopefully we do embed it with commissioners, it's got the voice of the young person right in the middle of it.
And Charlotte, can I just ask Charlotte, did you find the first meeting positive?
Yeah, definitely. I wasn't, to be totally honest, I wasn't really sure what to expect when I went along, but actually I was welcomed as just an equal into the meetings, and just my opinion was equally as valid as everyone else's.
Good. Pleased to hear it.
It's great. Do you have time for
well, I think I possibly have. I'm massively overdue now for my next meeting, but I've got time. I can do a couple of questions.
A couple of questions. So, roving mics and questions. I think we have one over here.
Faster, faster.
Thank you, Minister. I don't think anybody in the room would disagree with many of the things that you announced and mentioned today in your speech. Very, very welcome, and we really welcome the raising of the mental health of children and young people, the work that you've done over the past years. I mean, I cycle back and forth across Tower Bridge every morning to go to work in Tower Hamlets. And for the first time in my career of working in the public sector, cycling back over the bridge a couple of weeks ago, I felt that I was doing more harm than good. And that's partly because the service that I manage and that a partnership I lead on was facing cuts of 25% in our clinical resources. We just restructured our service to better deliver a lot of the things that you mentioned in your speech. And we're now once again being asked by our commissioners to restructure and redesign our service and recommission our service. And at the very end of that process, one of the risks is that we will be tendered as a service. I just wonder how your task force can help us quite immediately, really, on the ground to manage some of these conflicting and difficult challenges and risks.
Well, first of all, thank you for that. And I've always tried in this job to be straight with people and not to try and claim the world is different from what it is. So I totally understand the situation that you face and that is faced in many parts of the country. The Mind survey, the Young Minds survey a few months ago highlighted in a way the problem. it demonstrated actually quite a mixed picture. There were some areas that were investing more in young people's mental health, but some areas that were, in my view, ridiculously choosing mental health to take the cut. And this, within mental health as a whole, there is, in my view, an institutional bias within the NHS. So if you have a whole load of access and waiting time standards and a tariff in physical health, and you have nothing in mental health, it creates a central discrimination against mental health, and it ensures that mental health will always lose out whenever the money is tight. It's guaranteed. So that's why I think the announcement last week was so important, to start to create the equilibrium so that commissioners are forced to treat mental health as seriously as physical health. But we also know that this country, and this is a historic problem, invest a smaller proportion of the total spend on mental health on children's mental health, which again is, to me, irrational. It doesn't make sense when we know that so many of the problems in adulthood start when you're a child or a teenager. And this can't be changed overnight. But my view, and which I've expressed, and thankfully I've got my party to support now, is mental health needs more investment, full stop. And children's mental health needs more investment. We've said that you need 500 million extra a year going into mental health so that you ensure that these standards that we've announced really become comprehensive across mental health, including children's mental health, over the next 5 years. But I think we have to be just very clear and state the outright and outrageous discrimination that mental health suffers at the moment, and be very clear about what needs to change. And I hope, to answer your question, I hope that the task force does provide guidance to local areas in grappling with these challenges here and now. I think it's a real opportunity to do so, but part of it, as I said in the speech, is simplifying commissioning because it is ridiculously fragmented.
One more question back here.
I'm a clinician working in Leeds, so I'm on the floor. I was very happy about lots of things you said, but I was actually very disappointed last week. The issue of psychosis, it's a very small part, a very small number of young people who have psychosis, and in Leeds we see them within a week. I know that's probably not the same all over the city, but all over the country. So I felt that was probably a bit of a sham, really. I suppose what I wanted to say that in terms of our service, I'd like to kind of echo what that gentleman said over there. We're going through a very severe service review where we're losing 25% of our staff. Our senior management are making decisions. We will no longer be able to run Incredible Years parenting programme. And equally, we all take a turn on the self-harm rota where young people have been admitted to hospital following overdose, suicidal thinking, and very many of those young people are actually on our waiting list. That is not unusual. So, I would like that to be thought about as part of the task force.
Well, thanks very much for that. Again, I recognise the challenges that you're facing in Leeds. I should say on the early intervention psychosis, what you've described in Leeds is very good. It is absolutely not replicated across the country. And it's absolutely not, in my view, a sham. I'm very, very clear that there has to be a standard that wherever you are in the country, you get access to evidence-based services when you suffer your first episode of psychosis, and that is not the case at the moment. But I would also encourage you to read the vision document that we published at the same time, which makes clear that this is absolutely the start. This is not the end point. It has to become comprehensive across mental health services, eating disorders, for example. So NHS England have committed to doing the work necessary on data, understanding the data on numbers, on access, waiting times across a whole region in 2015-16, so that we get the evidence necessary to implement standards there. For me, it sometimes feels like wading through treacle backwards. Everything takes longer than I want it to take. I am totally impatient for change, and I recognise, and I tried to be clear in my speech, that it requires both change and investment. I don't deny that at all. But I think, again, I repeat, and I must probably end with this, I think we have the opportunity now, but I just think we all have to, from the top to the bottom, just be very clear about the fact that what is happening at the moment and what happens historically to mental health has to change. It's intolerable, and it must be treated equally. And that, that principle, making parity of esteem a reality, not empty rhetoric, is what drives me, and I'm sure drives everyone in this room.
Thank you, Minister, for taking time out of your busy schedule to join us today. I also want to say a massive thank you from children and young people for making mental health such a high priority.
Good. Thanks a lot. Thank you very much indeed.